Hey guys, it's Kyle Stefanski here, Executive Director of Rhonda's Kiss. I'm here with Amin Mirhadi, Advisory Board Member on Rhonda's Kiss. We're here to talk about the money that we recently donated to Cedars-Sinai after our recent event in Los Angeles, 2016.
Thanks for having me, Kyle.
Thanks for being here with us. This is a true pleasure, guys.
Your lovely mother, who unfortunately I never had a chance to meet, but from all accounts, having kids like you, she clearly was an amazing person.
Thank you. Thank you very much.
Had a very rare tumor. She had what's called a pancreatic neuroendocrine tumor. Those are not too common. Cedars-Sinai as an institution does a lot of research in neuroendocrine tumors in general. And one of the things that we're going to use with the resources that Rhonda's Kiss provided us is to try to develop a way to treat neuroendocrine tumors in the handful of cases that we get that are in the pancreas like hers, but in general, try to come up with a way to deliver the most precise, most focused form of radiation that we have available to us. And I think that this is something that we can combine with immunotherapy too to get the maximal results. Cancers like that are not as common often get neglected. The cancers that tend to get mostly attention are things like lung cancer, prostate cancer,
Sure.
and breast cancer, but we still can't lose focus on other ones because they still affect people, everyday people, just like your mom.
Yeah.
So it is nice to have, an organization like yours that's dedicated to trying to find solutions for that as well. The resources that Rhonda's Kiss has provided for us over at Cedars-Sinai Medical Center has been very helpful for patients. One of the things I've always appreciated about your foundation is your commitment to treat the cancer patient as a whole and not just to provide resources just to treat diseases like most people do.
Very important, yes.
One of the things that Rhonda's Kiss has done is some of the resources and the donations that you've given to us, they've been very useful in providing social services for patients. Now, social services is a very broad term, and basically what that applies to is all of the ancillary things around a cancer patient that might not be addressed by the doctor-patient relationship or the nurse-patient relationship. Obviously, we spend the majority of our time taking care of patients and taking care of their physical needs and their cancer-related needs, but there's only so much time that we have for things like that. So sometimes what gets overlooked are ancillary things that the patient might need, like things like transportation to and from their treatment, things like taking care of their appearance, like when their hair falls out, they might need access to wigs or people to help them with their physical appearance.
So easy to overlook something like that.
Oh yeah, absolutely. And I've always appreciated how you guys have been supportive of trying to make sure patients' peace of mind as human beings and their dignity is maintained. And it's a very nice thing to add that to your repertoire of how you help people. It's certainly been helpful for us utilizing these resources for that sort of thing.
Thank you, Amin. Really appreciate it. So that was part one of three of the donation style.
Yeah.
So the second part.
Well, I am a cancer specialist. My job, my training is all geared towards making sure if someone walks in that door with a tumor, that we address it, we take care of that. And there is enormous amount of information and science out there that could help us achieve that. And it's very hard to tap into that, especially without resources. Having the resources from Rhonda's Kiss to help fund research is a critical part of what we do. For example, one of the research studies that we are funding, thanks to the help of Rhonda's Kiss, is a research protocol that we've devised where we've developed a vaccine that we inject into patients that will prevent lung cancer from spreading to the brain. Immunotherapy is a very hot topic, and there have been a lot of great strides taken in terms of the progress they've made in immunotherapy, which broadly speaking is various ways to help us unlock the immune system to turn around and attack cancer cells.
Sure, I've heard a little bit about that. That's extremely important in cancer research.
And not only that, it's your own immune system. We're just priming and shepherding your own immune system to do the work for us rather than giving toxic radiation or toxic chemotherapy that can have that bystander effect and kill a lot of our normal tissue cells. But this research still needs to be harnessed, it still needs to be developed. And one of the things that Rhonda's KISS is helping to do, one of the projects, is a project that I'm very proud of that we've developed here in our immunology lab, where we've come up with a mechanism that we think the immune system can be unlocked in lung cancer to attack tumor cells from the lung that have a proclivity to spread to the brain. And we think this is going to, so far, in clinical experiments in the lab, on mice in particular, so far it's been very successful. So now we need the resources to translate that information, develop it in a way that it's going to help patients with early stage lung cancer to spread that, to help that from becoming late stage lung cancer that spreads to the brain. So that's a project that we're very proud of here, and we're looking forward to the resources you've provided to help us achieve that goal.
That's absolutely amazing. And so in lung cancer, what's the proclivity is to spread to the brain?
Yeah.
And where else?
About 30% of all lung cancers like to spread to the brain. As you can imagine, that's not a place where you want the tumors to go to.
Absolutely.
It can also spread to other organs like the bone and like the liver and things like that, but it tends to be a lot more difficult when we need to treat it in the brain. And very often, very frequently, that brain is the only place that it spreads to. By coming up with a way to limit that from happening, you're going to save a lot of lives. It's going to help, it's going to translate into a lot of lives saved by just that one step. And who knows, it might have the additional effect where we can develop it to have it spread from anywhere other than the lung, you know?
That's absolutely amazing. That's what we're all about here at Rhonda's KISS.
Oh, yeah, and that's one side of the coin. You know, as an oncologist, what I focus on is treating people who have cancer. But I don't see anyone that doesn't walk through the door without cancer. Another area of research that we're focusing on with the help of Rhonda's KISS is trying to develop ways to do a genetic assessment of people, of the general population, to do some type of screening in people that might be at high risk for developing things like lung cancer or breast cancer or colon cancer, and to try to develop ways to do an analysis of their genome so that we can identify what their risk factors are, and that we can, if for example, we find someone that is at a high risk of developing lung cancer, not because of smoking, but because of their genetics, we can screen those patients more carefully. We can do low-dose screening CT scans, you know, every year or so, and if we catch something, we catch it super early and save their lives. So that is another area that we've been developing with the help of Rhonda's KISS that I think has a lot of promise, and it's going to save a lot of lives.
We're really looking forward to seeing the progress of all of this. Now, I have a specific question on part one, the social service. How would somebody, apply for that with the money that we've given to you through Rhonda's KISS? How does someone seek that out? What's the process in that? Because a lot of people, are curious as to how the hospitals and organizations are, doling out the money.
As a healthcare professional, it's my job, of course, to treat the patients, but it's also our responsibility to assess whatever needs they might have. Now, if I think that patient has a great support network around them, they have great friends, they have great relatives, great family members that can help them with whatever they need, I might not take that additional step. But if I feel that someone doesn't have a support network, if they don't have friends or relatives that can help them with their treatment, then I refer them to our social services department. Then one of our social service workers will come and meet with that patient, do a full assessment of what their needs might be. And then from that point going forward, they will apply the resources that we get from you guys to help make sure that patient gets what they need so that they can live a comfortable life and so that they're taken care of as a person, not just a cancer patient.
I think that is extremely important. We don't want to stray away from the fact that Rhonda's KISS is focused on the patient and the families and the support system, and we're here to help. And it's just absolutely beautiful to hear what we've done with the $100,000 that we raised to give to Cedars-Sinai.
What's beautiful is when the patients come back to me and say, "Doc, I live alone. No one can take me to and from my treatment. I'm too sick to drive myself." And having resources like your guys to provide them a Lyft driver, an Uber driver, or somebody to help take them back and forth from their treatments, and to make sure they have access to whatever other resources might be out there, to make sure that they're not just left alone at home and that there's someone who can be there to take care of them.
Nobody should be left alone. Absolutely no one should be left alone. We're a family. We got to fight this together. Thank you so much.
My pleasure.
Really appreciate it.